I think something that it's well worth exploring a little bit now, which is the state of mind of individuals and collectively going forward, because it's not only that things are going to be challenged in terms of systems, things are being challenged individually. And I can't remember why this came to my mind, something we said earlier, but I was thinking of a young woman who was sectioned, that's put under medical care for her own benefit by professionals, perhaps pre-95, maybe 80s, but early on in my teaching career. And I can recall then people coming to healing courses, yoga courses, classes, and looking for an experience. And so I'm feeling my chakras, I'm seeing colours, I'm hearing voices. And at the end of a meditation circle, you would talk about such things and enjoy the fact that people were connecting with a part of themselves they hadn't connected with before. And this particular young woman would participate in those and would share, and she was a regular, and no one in that circle noticed anything different. And I say that I did notice something different in my interaction with her, and then when she came one time and said to me that she had put herself under professional care, because remember the story was that anyone might come and say, "I'm hearing voices, isn't it wonderful?" But her story was, I'm hearing voices, I'm hearing what the neighbours are thinking about me. And that always stuck in my mind. I'm hearing what the neighbours are thinking about me. A while ago, I found myself working with people in different aspects, but broadly I touched on some different areas of mental health, and my own view was that everyone is what was termed then mentally ill. It's just where you draw the line. So no one's perfect, so everyone doesn't meet that norm. But what I'm inviting you both to comment on is that now, at that time where we have lived through a kind of a spiritual awakening. Ash behind the camera was talking about 2012 and the awareness of the expectation that something would happen at this magical onset of the Aquarian age. I just got this feeling that we're going to be very challenged in this particular area in the next few years, as people don't quite know what their reality is or the collective reality is, and let's move that around a little bit if either of you want to bite.
Well, I think that's very much what's happening, because we get the scenario that the Piscean paradigm is literally kind of falling apart, getting shaky, and so all of the big institutions that we relied on, that were the kind of the edifices of our culture, they're all kind of falling apart. That means there's more insecurity and anxiety, because it affects money markets, affects jobs, and so it affects people at a very kind of personal level like that. If you add to that the increasing levels of pollution across the planet, I think we have a situation in which more children who are being born now are much more oversensitive, hypersensitive, allergic to much more, and the gene pool is known to be deteriorating. So when you put all that together, that equals less mental stability.
Well, I totally agree with that.
And that's the real problem, that we're dealing with a whole generation of young people who are who've largely been brought up on worse quality food, and who aren't being, if you like, spiritually trained to deal with this new world, the new world that's kind of really falling apart until it finds its new level. And I think all of that is a recipe for a lot of social problems and unrest.
Also, anyone who changes their level of awareness to any great extent will be mentally unstable.
Yeah.
Now, whether that means that they're mentally ill or whether it's a temporary phase that they're passing through is absolutely key. You know, as you know, both you know, I worked in mental health for many, many years, both with staff and with patients. And, I mean, I'd come out of those hospitals sometimes thinking, I think we should lock the staff up and let the patients out. You know, I mean, because it's sometimes very, very difficult to tell. And people who are sectioned, you know, have to compulsorily be in the atmosphere of a mental health hospital for a minimum of a month. Well, unless a very close eye is kept on supporting the staff, they're going to get the disease to a greater or lesser extent.
Sure.
So I think it's vital that we really concentrate on our hospital staff, our emergency services, to keep them strong to deal with this massive epidemic that is now beginning to swamp us.
Yeah, and that's a good way to phrase it. Because I said a few minutes ago that you know, somebody goes through a training course and they're in a bubble with the other group, and then they go out, and you know, it's how they sustain themselves, you know, trying to apply that in their everyday world. But the challenge that comes now, I'm feeling, isn't just about committing yourself to a course and then dealing with it afterwards. It's that the experience, the change is happening anyway. So people are finding just through ordinary everyday life, they are being awakened, or they're being challenged, or they're being totally stressed out, and they're having to deal with that. And the support network isn't there, you know, because we don't talk about that. We're not just talking. I'm not just talking about mental health now. I'm talking about things that are fundamental to our well-being, and you know, enumerated a few of them a few minutes ago, Guru.